Hi, my name is Megan Ranney. I am an associate professor of emergency medicine at Brown University and the chief research officer of AFIRM Research, or the American Foundation for Firearm Injury Reduction in Medicine. And I'm going to be here today to talk a little bit about one of the most intractable problems of our time, gun violence, as well as to start to outline some of the ways that I think we can solve it and the purpose of this workshop. So I'll start with some stats. As many of us know, firearm injury is a persistent and seemingly impossible public health epidemic in our country. Every day across the United States, more than 100 people die and more than 200 are injured by a firearm. The majority of deaths, contrary to public opinion, are actually suicide. 2/3 of gun deaths each year are suicides, and most of those are sustained by white men. The problem, of course, disproportionately affects our young minority male community. Young Black men have 20 times the risk of dying of firearm homicide compared to young white men. But the problem touches all of us. Every month, 76 women are shot and killed by their partner across the United States, and firearm injury is the second leading cause of death for American children. Now, during the time of COVID-19, we've been lucky enough to have no school mass shootings, but the problem remains and may even be worsening. Stats from the National Shooting Sports Foundation suggest that more than 2 million extra new guns were bought between March and May of 2020 compared to the same time period last year. And although data is still being collected, preliminary analyses suggest that the number of gun homicides has stayed stable or may have even increased during COVID-19. Similarly, domestic violence and suicide by gun have anecdotally increased. The patterns of gun violence mirror the patterns of hopelessness and political partisanship across our country. Now, it's normal to feel that there is nothing we can do about gun violence. We have been stuck in the same cycle of debate between gun rights and gun control for the past 20-odd years. But when we get stuck in that debate about policy, we forget about the history of public health, which teaches us that although policy is certainly critical, it is never sufficient for solving a public health problem. We can look to so many stories across the history of public health. Car crashes are one of my favorite. We've decreased car crash deaths by over 70% over the last 30 years, not by banning cars or taking them off the road. In fact, there are more cars on the road and more millions of miles driven, excluding COVID-19, compared to ever before. But rather, by using good science, by using a multimodal approach, by changing the engineering of cars, by educating people about the dangers of drunk driving and the importance of car seats, and of course, by good economic incentives to encourage safe driving. Similarly, we've decreased the death rate and the transmission rate of HIV/AIDS, not by banning sex or banning drugs, both of which we know don't work, but rather by combining good science, research on antiretroviral therapy, with good behavior change science, talking about harm reduction, destigmatizing populations, engaging the communities most at risk in designing solutions that make sense for them. And that's where I see hope in gun violence. Approximately 3 years ago, AFIRM was founded by myself and another emergency physician, along with a number of partner organizations, including the American College of Physicians, to help create a public health, nonpartisan approach to gun violence. In our first year of existence, we led the This Is Our Lane campaign to help mobilize physicians, nurses, and other healthcare professionals in recognizing that gun violence is indeed a health problem. In our second year of existence, in collaboration with our partner organizations, we advocated for $25 million being put into the federal budget to fund firearm injury prevention research at NIH and CDC. It's the first time in more than 20 years that that's happened, and it's thanks to our work in collaboration with all of you. At this point, we've succeeded in getting most healthcare professionals to buy into the idea that gun violence is a health problem and can be addressed as such. And we have some very promising data suggesting that separation of a gun from a person at risk can reduce the risk of suicide or homicide, showing that it is possible to identify risk factors, and with research funded by a firm, developing curricula and learning objectives for health professional students of all ages and across the spectrum for gun violence as a public health problem. We have begun to make progress. Where we are stuck, though, is that the solutions that we have are still within our healthcare community. We have failed up until now to engage the communities that are most at risk. We have not engaged gun owners, whether they be rural white men or young urban youth. We have not engaged the people who want to create change in any way other than in debates about policy. This, to me, is the promise, and this is the point of the workshop, is to talk about ways that we can reframe the conversation, not just within the healthcare community, but also within the community who we are trying to help keep from being injured or killed. Now, over the past 2 years, a firm has worked with a series of stakeholders, including groups such as the National Shooting Sports Foundation, 4-H, local violence intervention programs, the American Foundation for Suicide Prevention, and many others, to develop community-led, community-based events that share narratives about the experiences of gun violence and the prevention thereof in order to allow an entree into implementing and extending evidence-based prevention programs, and to allow the evaluation of those programs so that we know that they really work. In this workshop, I hope to explore with all of you the ways in which we can bring our great joint knowledge about how to address sticky societal issues on a community-by-community basis to this issue of gun violence. I've learned that we don't have to be hopeless, that there is a way forward, but it requires a combination of both the very best evidence that public health and medicine can bring to bear and a deep rooting in the values and priorities and fears of an individual community. My hope is that we can discuss both which communities are most ripe for intervention, how best to engage community leaders, how best to evaluate the efficacy of these events, and hopefully bring to the table some new strategies for intervention that we may not have otherwise heard of. I am looking forward to brainstorming with all of you and to creating solutions that can help move our society forwards and address at least this one small part of the seemingly impossible partisan hopelessness that we sometimes seem stuck in. Thank you, and I look forward to seeing you in a few weeks.